Hello.
Hello, good evening, ma.
Good evening. Longest time.
Yes,
How are
ma.
you?
I'm fine, ma.
Unfortunately, I can't see your name here.
Ah,
It's not showing your name.
what happened?
So you can do that later. Just remind me your name again.
Additional side that.
Adeshino. So how have been our lockdown,
We thank
preparing
God,
for
ma.
exam, family
We
and everything?
are fine, ma. Thank
And how was the week one of our revision class? I term it revision. Yes. We are actually using it for trying to deliver it better,
you so
our
much,
online
ma.
program better for you people. So how was the week one?
Fine, ma.
But you were not able to join in the discussion forum.
Yeah, I don't get how to join, ma. I tried. Fine.
Yes, but for topic two, there was an email that I described the step by step for you to be able to join in the discussion forum.
Yes, ma. I've seen the email. I've received the email.
Okay,
So I will
so
try for that
we'll start
topic.
topic two by God's grace tomorrow. We enter week two. So we'll start our topic two. So I believe that there won't be much problem with that topic two. I'm still trying to wait for the other member of the class. If they will join us, let's just give them like 5 minutes
All right, ma.
to come up. So how are you preparing for your exam?
We are trying, ma. I'm trying. I'm reading. I'm reading.
Yes, you have to read. You have to read. You have to read. There is nothing good come without you just try to push yourself small from your comfort zone. Hmm? Anything, yes, you can testify to that. That whatever you want to do in life, you cannot just get it on a platter of gold. You have to put little effort for you to achieve it. Am I right?
Yes, ma.
So let's just give them like, maybe we'll start by 8:07. It's just a recap we want to do of what we did in our week one. Then if there is any question and we'll be able to talk one or two things, then we'll move to week two by tomorrow. So let's just by 8, we'll start by 7, let's say 5 minutes past 8. I hope they will be able to join by then.
All right,
Okay.
ma. The main participants. Okay. Orúkọ fóònù mi ló gbé jáde o. My name. How is sleep? Go and sleep. What do you
Okay. Allow me. Okay, she's still trying to join. Let's just give her some minute to join. Probably she's still struggling with her internet. Hello. Hello, allow me.
Good evening, ma.
Good evening.
Good evening, ma. I am with
Good evening.
you, ma. Good evening, ma.
Yeah. How are you? Can you put on your video? Let me see your beautiful face. Can you put on your video? Hello. Hello, allow me. Hello. Hello, allow me. Good evening.
Good evening, ma. Let me get you.
How are you?
Good evening, ma. Yes, ma. I
Good
can hear you, ma.
Yes, how are you?
I'm very fine, ma. Thank you, ma. Yes, ma. Good evening,
You are
ma. Good
welcome.
evening, ma. It's
Good
nice
evening.
joining you, ma. I'm very fine. Thank you, ma.
Thank you.
Thank you
Nice
very
seeing
much,
you
ma.
people once again.
Thank you, ma. Good evening, ma.
I'm happy to see every one of you. Yes, the class, we're supposed
Thank
to
you very
have
much, ma.
about 20 of you in the class. But
Thank
probably
you.
the other people will, yes, I hope other people will still join us before we end the class. So how was the week one?
Hopefully, ma.
How was it?
It was interesting, ma. The lesson was well understood. It was beautiful,
Okay,
ma. The lesson was well understood, ma.
okay.
Yes, ma.
So what we are going to do this evening, we are just going to do a recap of what we learned.
Yes,
Then
ma.
we'll just do 2 or 3 topics that we did not touch during the video, in the video now. So we'll do that one. But
Okay,
what I
ma.
want us to do now, say that you are with us. I hope
Yes,
you are
ma'am.
hearing. Yes.
Yes, I'm
So
hearing you.
I just want us to share our experience. Like I said in our video, that one good thing about this course is that it's a practical course, and it's what we do every time in the hospital, health assessment. As that is the name of the course on its own, health assessment. And as a nurse, or let me put a question to us: can you be a nurse, a practicing nurse, without assessment, conducting assessment, irrespective of wherever you are? Maybe I should hear from our professional nurses. Before I start, okay, say that, where do you work?
I work at Federal Medical Center.
So you are
Abeokuta.
in the clinical. You are a good person to,
Yes.
yes. So you are going to teach us today. Olawumi. Hello. Hello, Olawumi. I think our network is fluctuating. It's fluctuating. So over to you. Say that after you participated in the lesson 1, What is the new thing? Or let me even ask you, normally, how do you conduct your physical examination? Maybe we should start from our general survey. Outside, yes, outside the lecture now, outside our lecture on topic 1, traditional, normally, as a professional nurse, how do you conduct your physical examination?
Physical examination of patients start from the first contact with the patient. If you, as the patient is walking in towards the nurses, we start our examination. We look at the physique of the patient, how the patient walk. Then during the physical assessment, or let me say from the history taken from the that we do from the for the patient, we during the history taking we observe how the patient behave, we observe the speech, the strength, we observe whether the patient is conscious or not, whether the speech is coherent or incoherent one. Then we observe the physical appearance of the patient. If the patient is neat, we observe the gait. Then during the physical examination, that one will start from head to toe. So we check if the patient is neat. Then we look at the nutritional status of the patient. If the patient is well fed, we look for any abnormality. There are some special diseases.
We are talking about general physical examination. I just want us to limit ourselves to our topic 1, which is physical examination techniques. You know, the first part you started with, when you started that, okay, we started our assessment and the patient is entering. Now, let's retrace our step back to our topic 1. What do you call that?
That is inspection.
That is
inspection.
Inspection, or what? Then what is now our general survey?
Okay, general survey is we collect data about the patient on admission, the age, the appearance of the patient. We check the vital signs, that is temperature, pulse, respiration. We observe the patient for speech. We observe the patient physique. So we have to write general the summary of the examination that is carried out on we observe the patient.
So
then
thank
we
you
record our findings.
Okay, so from the little explanation you gave to us, the moment that patient is coming in, you start your general survey from that moment. Do you understand? Am I right? Then you now proceed. Yes, you now proceed to start asking certain questions related to the patient. You now move on to your assessment. Are we together? But when you look at general survey, and the physical examination techniques, you can say that they are interwoven. Am I right?
Yes, ma'am.
That is practically now. Hear me? I think our members are having issue with their network this evening. I just hope we can. Okay. So let me just share my screen with you, then we'll look at the recap. When you are doing general survey, you are going to do inspection. That is when you say that, that is why I say that it's interwoven. You cannot do general survey without you looking at the patient. Are we together now?
Yes,
The
ma'am.
same thing, by the time you start doing your physical assessment, as for you are trying to take your blood pressure, your baseline data, you make use of some instruments. So auscultation may come in at that point. Do you understand? By the time the patient say, okay, you are taking the weight, the height, all those ones are objective data that you take through your physical examination techniques. Am I right?
Yes, ma'am.
So now, watching the video and participating in in topic 1, what is the new thing you gain? Say that while the other member of the class is still trying to join.
I gained how to do deep palpation.
Okay.
And how to percuss.
Okay. So were you able
then
to?
Another.
Okay, I'm hearing.
Another thing is, did I remember that? The sound given the normal long sound too.
Okay. So thank you. Were you able to practicalize it on any patient or yourself?
No, ma.
You know, practice makes perfect. If you just the theory aspect, there is tendency for you to forget. And if you listen to that video very well, I stated it there that even on each of these practical, try and each of the examination techniques, try and practice it on yourself, on your friends, on your child. And the more you do it, the more you are conversant with it. So let me quickly share my screen. Can you see my screen? Say that.
Yes, ma'am. Yes, ma'am.
Yes. So we have done our recap on general survey, physical examination. We'll progress to equipment for physical examination and also organization of examination. So we are going to spend more time on the last 2 objectives. We have said it that with general survey, you make use of your eyes. And from our knowledge on physical examination technique, you can say that is inspection. Are we right?
Yes, ma'am.
So you cannot do general survey without inspection, and to a large extent, you have to do either percussion or palpation so that your report on general survey can be adequate enough. Then physical examination, I'm so happy that at least you're able to gain 1 or 2 things new from your previous knowledge, which I said that you have to use it. And also remember that we mentioned the sequence of the abdominal examination being different from other examination of other body that require the four types of physical examination. So like we said that for abdominal examination, the sequence is different from when you are doing general body examination. For general body examination, you first of all do, let's take example of, give me an example, say that.
The one that we
Give me
use
an example. Yeah, that we use the 4 sequence, one after the other. As for, we start from inspection, palpation, percussion, and lastly auscultation. Examination of where can we do that?
Of the chest.
Of the chest? Okay, why don't we say breast self-examination? Or yes, the chest cavity. If you say of the chest, yes, because the breast is within the chest cavity. You first of all do your inspection. Yes, you are interested in the examination of the breast, but because the breast is within the chest cavity, do you understand me now? So you start from inspection. How does the chest look like? And you now move, okay, this organ that is on the chest, so what is the shape? And all this one are still inspection. You now go ahead and you do palpation. When you do palpation and you now like, okay, let me percuss the lung. Are we together? That is based
Yes,
on your palpation. You discover that, okay, you need to hear the sound of the chest cavity. Like we said that the normal sound of a bone and which is a dullness sound. When that sound is deviated, because you know the chest cavity is made up of bones, more of bone structure. Do you understand now? So when that sound, the normal sound that is supposed to hear under the bone, you now like, oh, something is wrong. Let me proceed to auscultation. Are we together?
yes, ma'am.
Yes. Then you can say, okay, for chest examination or chest assessment, that is the chest cavity assessment. You can make use of all the 4 types of a physical examination in the sequence it appeared. That is inspection, palpation, percussion, and auscultation. However, when you are talking about abdominal examination, it doesn't follow that sequence. And we stated the reason why it doesn't follow. Can you remind me?
Because the abdominal organs can be displaced during palpation. So, and it can alter the bowel sound too. If palpation is done
Okay.
before auscultation.
Okay. 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 So now let's quickly look at equipment for physical examination. Before this slide, give me the one that you can remember.
Well, sphygmomanometer, then the stethoscope, the tuning fork, patellar hammer,
Okay.
thermometer,
Yes.
otoscope.
Okay. Thank you very much. We have tried. Yemi, try and unmute yourself. Hello. Okay. Because we have limited time, just let us continue. I think we are getting more now. Somebody else has joined again. I know that the time might not be convenient. Actually, it's not convenient for me, but we just have to do this video this night so that I can see your faces again and do a recap of what we have learned in topic 1 before we progress to topic 2. Hello, Binta. Hello. Hello, Binta. Okay, so let's go on with our lecture. When they are ready, they will join us. They will unmute themselves and they will contribute into the discussion. So this is the equipment we have. We have the stethoscope. And you know, the best way to remember all these things, when you want to conduct our normal vital signs, what do we need? Definitely, there is no how you will take blood pressure that you will not make use of your stethoscope and your blood pressure apparatus or the sphygmomanometer. Then you need your cotton ball, that is the cotton wool that you are going to use to clean, and the alcohol that you are going to use to clean your instrument. Then you need ophthalmoscopy or otoscopy. What do you need the pocket flashlight for? Say that.
Ma.
What do you need pocket flashlight for?
Be to observe for color of the skin.
Okay. Yes, if there is any discoloration in the skin, yes. Then what about tuning fork?
To check for patellar reflexes. Yeah, do I get it?
Yeah. Ali, you try. You try. Tuning fork is to check for any abnormality within the patellar region. You try. So, but normally, all this in practical setting, in our hospital, in your clinic, what do you use for physical examination?
What we get is that we provide privacy for our patients. Then we set our
Yes.
tool, the sphygmomanometer, the stethoscope, the cotton wool swab, the methylated spirit, then the otoscope. Now we get
Okay,
it
do you
ready.
make use of otoscope in your hospital? Do you make use of otoscope?
We have it, ma. We use it for our patients.
Okay. Is there any special patient you could use it for?
Patients with ear problem.
So normally, general physical examination that you conduct on your patient routinely, does it include ophthalmoscopy and otoscope?
No, ma.
So
That one
in
is
another word, yes, in another word, the equipment you need for your physical examination actually depend on the clinic you are. That is driving our point to practical session now. Do you understand?
yes, ma.
Let's assume that in a pediatric clinic or child welfare clinic, a mother complained that my child is running temperature. Yes, we have stated it and we have established it in this class that our assessment starts from when that patient is coming in, and when the mother remove the child from the back or carrying the child, we start our assessment. Do you understand now?
Yes, ma.
Is that assessment that determine what equipment we are going to use for physical examination? Please take do you understand what I want to say now?
Yes, ma.
Yes. Is that your assessment that will determine what examination you are going to do? If that child, the mother say, oh, this child is having temperature, and with your own assessment, that child is not pale, he or she is not dehydrated, do you need the tongue blade to do assessment, to add to your assessment tray?
It's necessary just to check the oral cavity of the patient.
Thank you. Because there are other things that can actually cause the high temperature or rise in temperature. Is that right?
Yes, ma'am.
So in such case, for a child having fever, which of these equipment will not be there?
The one that is patient's gown is not necessary because we need to expose the patient.
Okay.
Then percussion hammer is not necessary.
Beautiful.
Blood pressure cuff is not necessary.
Okay. Why?
Stethoscope is not necessary.
Why blood pressure cuff is not necessary?
because we have to treat the fever first. Then if there is any underlying issue, since it's a child, so it's not much, there is, unless there is any evidence that there may be an evidence of that may indicate increased blood pressure, that we normally do that.
Thank you very much. I think we have, now let me make a point here. Under paper cup with water, for this particular scenario we are looking at, for a child that's having high temperature, what is the essence of this paper cup with water as part of your equipment for physical examination?
We have to give the child cold drink.
Yes.
Then there
And
may we need to tap a sponge.
okay, now you will not tap a sponge with the paper cup with water. You have to give that child water to drink, and you also observe if the child can retain anything within the GIT. Do you get it now? Because definitely if the child cannot retain anything, by giving the water to the child, that child will vomit. So how do you organize your things during physical examination? What do you do when you are doing physical examination? Physical examination should be done systematically. Systematically in the sense that for this particular scenario we are looking at, you have to do inspection. You will not jump from inspection and you start with palpation. Then after palpation, you come back to inspection. If you are doing it like that, that shows it's not systematic again. Are we together? So it must be done in
Yes,
a systematic way. And while you are doing your procedure, you have to explain to your patient. For instance, that child, depending on the age of the child, might be afraid of thermometer. Do you understand? That's why it's a child. And some mothers, depending on where you are practicing, some mothers may even like you're coming to you, the child might have even convulsed at home before coming. But while you are doing your assessment, you might not see that, oh, this child is weak, this child is dehydrated. To you, this child is still mildly sick, not severely sick as the mother look like. You know, the mother will look anxious depending on the state of the child before they reach your own clinic. So that is why everything you are going to do, madam, the woman will like, oh, my child is shivering, why do you need to remove the dress? So you now have to provide explanation to everything, explanation for everything you are doing for that patient. Do you understand? And I believe even we ourselves, I myself, put myself in the position of a patient. If the healthcare provider, the nurse, the doctor will be able to tell me that, oh, this is what I'm doing for your child, this is what I want to do, I'm sure that will be much relaxed. The same thing happened to the mother of the child. So you take time to explain to the client every examination you are going to do, and you also ensure the comfort and safety of that child or of your patient. Like you said, you mentioned it earlier that you provide privacy. Yes, that's why it's a child and you are going to expose the child, you still have to provide privacy. You don't just have to say, madam, remove your child dress when within the reception before everybody will be coming. There might be a kind of deformity that they may don't want people to see. So privacy is very important when you are doing, when you are rendering nursing care or care to our patient generally, not only during physical examination. And like I mentioned it before, you have to do it in a sequence. Every time you have to follow the sequence, and you also have to adapt your physical examination to suit the elderly. You have to make sure that your observations suit the elderly. I think some of our people are not able to join. I'm receiving email here. So what are the organization or the general approach you need to adopt when you are conducting physical examination for the elderly? Because of our time, let's quickly look at the general approach. For the elderly, just give me a brief description of an elderly.
An elderly person is somebody that is of old age, like let's say 60 and above. No, some people at age 60 may still look agile. So we may put it at 70 and above, depending on the health status. Depending on the
Okay.
health status of the person.
Okay, thank you. Technopop 2 Plus, it will have been nice if you can put on your name. Can you put up your name? Technopop 2 Plus. Hello? Hello? So, thank you. So, for such an elderly person, you know, the elderly old age come with challenges. I'm sure we are aware of it. Even forget about the educational aspect, the academic level, we have old people at home. The moment they clock that age, like 60, retired, you know, they have a lot of challenges. If it's apart from the menopausal syndrome, this and that, but when you talk about mobility, some of them has limitation in mobility. And like you said earlier, it also depend on the age of the individual. And some of them, if they are advanced in age, you see that there is a kind of weakening from time to time. And because of that, when you are doing physical examination for this particular set of people, you have to put them into consideration that, you know what, you are not going to do it as, you are not going to handle them the way you handle a younger one. That, okay, stand up, I want to see your gait, sit down, I want to see this, match. You understand now? You have to arrange yourself in such a way as a professional, in such a way that you cause a minimal discomfort for your patient. So you have to position your patient. Because of the physical limitation, you have to avoid unnecessary changes in position. Now, when you finish everything you want to do, you need to write report, because every activities you carried out on your patient without report is as good as you have not done anything. So how do we write report? Because that is where we will end it. After you conduct your general survey, you do everything, you have to write report. So how do you write report? Technopop. I think their network is not really helping matter because of our time. When you are writing a report, definitely you start from personal data, that is the name, the age, the height, and everything that relates to that patient, and also parent information if it's a child. But if it's an adult, as the initial, that is the, and you, secondly, you also, after you concluded on your personal, on the patient personal data, you proceed to patient history, that is immunization history. If it's a child, even an adult, which immunization has he taken? Which one did he or she supposed to take? That is subsequently. And all this history regards immunization, you take it. Then you also review your patient health problem. Review patient health problem, that is any medical history like diabetes, health condition. And for your health examination to be effective, you have to be able to render a kind of advice that can have positive effect on the patient life. Now, it's contrary to the patient did not come to complain to you that I have diabetes or I'm urinating frequently before you start thinking of diabetes. During your examination, when you carried out the height and weight, and you discovered that patient BMI is high. However, the patient did not have diabetes, but because of this your physical examination, you are going to put it as part of your report that, oh, this patient BMI is high. And as nurses, we know the implication of high BMI to an adult, especially when it's an adult, you know the implication of that. And at that point, you also indicate that, oh, because of this, you have to take certain precaution, like, okay, probably exercising daily or weekly. And all this information, you put it in your report. Remember, this individual might not come to you because of this, but you are able to detect all this because you carried out your physical examination. Then you also move on, you also record issue of, okay, does the patient have any report in emergency unit and what is the reason why? You have to also report on patient personal and lifestyle behavior. If the patient smoke, drink, and what he or she does. Like, okay, is the patient physically active? And it depends on the condition of the patient or the complaint of the patient. You can also ask about other issues that can result to a stressful life situation. Such as pressure at work or individual being divorced. And you also notice physical limitation or disability. Is the patient able to stand well, able to walk well? Like we said, from the time he or she is walking in, he may not tell you that I have joint pain, I have rheumatism. But if you see the way the patient is coming in, you will now have to ask a follow-up question. Even if the patient, oh, what is happening? Why are you walking like this? Anything wrong? The patient will be able to say, oh, this is what happened, this is what happened. Remember that the patient might not even remember that. In another words, that the part of that patient, that condition is part of that patient. So he or she may not see it as a new problem. So in conclusion, you conclude with the patient, with your report on writing the patient concern. What actually brought that patient to the hospital? Because of our time, let me end it here with question. I don't know if you have any question that you want me to answer before we close the class. Any question?
No question.
No question. So if I ask you question now, you'll be able to answer everything.
Yes, ma'am.
Eh?
Yes, ma'am.
That is interesting, oh. That is very interesting. So what happened? Is there anything you want me to put into consideration that, okay, in topic 1 you discover this, so if topic 2 can be better off in this area? Is there anything you want to tell me about it? Probably the lesson note, the times table, the way we set everything. Is there anything you want to tell me? So that at least when I'm doing the topic 2, I can put that into consideration too.
I think the discussion forum, you put time limits. Maybe you can leave it open for us so that it will not be for that Wednesday alone.
You know why it will not be open? Yes, because if it's open, it's no more assignment. Hello.
Hello, ma.
Yes, if you leave it open, and if it's an assignment in our conventional school, even forget about other university. Now in your school of nursing, for instance, when they give you assignment, did they give you infinity time to finish? There will be time set. Am I right? And remember, we
Yes,
have
ma.
times table. We have times table for the week. So within that times table and all these things, at least it will engage you. You have the feeling that yes, you are a student, you are doing what you need to do. Do you get it?
Yes, ma.
So thank you very much. Technopop, can you contribute before we close? No. Thank you. See you next week by God's grace. Then please watch out for
Hello, ma.
the topic 2 and do the discussion forum and participate in the test.
Yes,
Now,
ma.
for the 4 of you, have you put down the questionnaire I sent to your email? Have you completed it?
Yes, ma.
Okay,
Yes, ma.
thank
I've
you.
completed my own.
Okay, thank you very much. I think the network is not friendly to the other people in the class. Okay, bye bye.
Bye bye,
See you
ma.
next week.
All right, ma. Bye bye, ma.
Bye.